discussing bed making and bed safety. This information can be found in chapters 21 and 22 of your textbook. First, we're going to discuss bed positions. Fowler's position is a semi-sitting position with the head of the bed raised between 45 to 60 degrees. High Fowler's position is a semi-sitting position with the head of the bed raised to 60 to 90 degrees. Semi-Fowler's position is when the head of the bed is raised to 30 degrees. With Trendelenburg's position, the head of the bed is lowered and the foot of the bed is raised. Finally, reverse Trendelenburg's position, the head of the bed is raised and the foot of the bed is lowered. This picture shows a bed placed in Fowler's position. This picture shows a bed placed in High Fowler's position. This is what you would use when feeding a patient or when brushing teeth. This picture here is Semi-Fowler's position. This picture here is Trendelenburg's position. You can see that the head of the bed is lowered, the foot of the bed is raised. And finally, this is reverse Trendelenburg's position. So the head of the bed is raised, the foot of the bed is lowered. With bed safety, it's important to have the bed wheels locked or braked at all times, except when you're moving the bed. Entrapment is a risk with hospital beds. Entrapment refers to getting caught, trapped, or entangled in spaces created by the bed rails, the mattress, the bed frame, the headboard, or the footboard. The persons at greatest risk for entrapment are older individuals, those who are frail, confused, restless, have uncontrolled body movements, have poor muscle control, are small in size, and patients who are restrained. On the next slide, we're going to go over the 7 zones of entrapment. So the 7 places that patients are at risk for getting trapped in beds. So the first zone is within the side rail. The second zone of entrapment is between the top of the compressed mattress and the bottom of the rail between the supports. The third zone is between the rail and the mattress. The fourth zone is between the top of the compressed mattress and the bottom of the rail at the end of the rail. The fifth zone is between the split bed rails. The sixth zone is between the end of the rail and the side edge of the headboard or footboard. And finally, the 7th zone of entrapment is between the headboard or footboard and the mattress end. Bariatric beds are beds with a wide frame and a weight capacity from 500 to 1,000 pounds. Bariatric beds vary depending on the model. Some can become a chair without moving the person, so the footboard becomes a footrest, like what's seen in this picture. Some have power transport to move the bed, so the patient doesn't have to transfer to a stretcher. Most bariatric beds have a pressure relief surface to prevent pressure injuries. And oftentimes they'll have a trapeze for the person to reposition themselves. A trapeze is the blue triangle device that's seen in the picture. The patient can use their arms or upper body to reposition. There are a variety of linens that are used when making a bed. First is the mattress pad, and that's just a piece of fabric or material that's used to make the mattress more comfortable and protect the mattress from liquid spills. We have top and bottom sheets. The bottom sheet is fitted, the top sheet is flat. Draw sheets are often used. A draw sheet is a small sheet placed over the middle of the bottom sheet. It goes from the patient's shoulders to below the buttocks. It's used to help lift or turn the resident. In nursing centers, the sides are tucked under the mattress. Cotton draw sheets are draw sheets made of cotton. They help keep the mattress and bottom linens clean. Padded waterproof draw sheets are draw sheets made of an absorbent top and waterproof bottom. They are used to protect the mattress and bottom linens from dampness and soiling. Bed protectors have absorbent, fabric-backed, waterproof material. They're used for residents who are incontinent. Blankets may be personal or provided by the facility. Bedspreads add a decorative look to their room. They may be personal or provided by the facility. Pillows are used for comfort and positioning of the resident. Pillows always stay covered with a pillowcase. And bath blankets are blankets that are used to keep the resident warm during a bed bath or linen change. When handling linen, it's important to wash your hands before touching clean linen. You want to collect the linen in the order that they will be used on the bed. Never take linen from one resident room to another. When carrying linen, take care not to touch the linen to your uniform. Wear gloves when removing soiled linen. When removing linen from the bed, turn it from the ends of the bed toward the center of the bed. Never place used linen on the floor. Do not let used linen touch your uniform. And place used linen directly in the hamper. There are a couple different types of beds that CNAs are expected to make. The first is a closed bed. A closed bed is not in use. The bed is ready for a new patient or resident. In nursing centers, closed beds are made for residents who are up during the day. An open bed is ready for use. The top linens are fan folded to the foot of the bed so the person can get into the bed. A closed bed becomes an open bed by fan folding back the top linens. An occupied bed is a bed made with the person in it. Finally, a surgical bed is made to transfer a person from stretcher to the bed. This first picture shows a closed bed. This is a picture of an open bed. The top sheet, blanket, and bedspread are folded down to the foot of the bed so that it's ready for the patient to get in. An occupied bed is one that's made with the person in it. You would have to put the bed rail up and roll the person, similar to how you position a patient on their side. Change the linens, then change sides that you work on. And we'll practice this in class. And finally, this is a surgical bed. You can see that the sheets are pushed to the side so that a resident can transfer from a stretcher.